Okay, so over the past week, I've been getting a lot of questions regarding healthcare changes coming up in open enrollment. So I've got all these questions here, and I'm just going to answer them now for you. So the new rates for most health insurance companies, and I know for sure Blue Cross and Blue Shield, will come out November 1st. Now, through an inside source, I have an idea of what the rate increase will be, so I can give you a quote, a very close estimated quote of what the cost will be for insurance. Now, November 15th is when open enrollment begins. That means that's when us as brokers or health insurance companies can start accepting applications for insurance, effective January 1st. January 1st, 2015 is the earliest you can get coverage. So we can get you quoted now, get you ready, and then as of November 15th, we can start accepting those applications and submitting them into the companies. What's the difference between going through a broker or directly through the company? There is no difference in regards to cost. There is a difference in regards to service. Working with brokers, we are another individual that is working for you. If you go directly through a healthcare company, you've just got their customer service number to call. If you go through a broker, you still got that customer service number to call, but we're going to work for you to make sure whatever changes or whatever questions you have, they're answered and things are getting done for you. But cost-wise, you pay the same going directly through a healthcare company or going through a broker. There's no additional charge to do that. How do I notify my employer if I'm moving over my spouse and dependents? Most groups, I'll say most groups, but if a group renews their plan January 1st, most likely by the end of by November 30th, they're going to need notification if your spouse and dependents are going to stay on the group plan at your job or at your school or wherever you work. So that's why now's the time to get the children and get your spouse quoted up. If it's going to save you that $400 or $500 a month, let's get ready now to get that transition and move them over. And talking about this cost savings, the deductible, the coverages, they're very similar, if not identical. There may be just a slight variation in the deductible, but with the monthly cost savings, and I'm talking about maybe a $250 to $500 deductible more or less a year, it's worth it going to individual because you're saving that $4,000 or $5,000 a year. It is a big savings and most people don't know it. If you are on a group plan, you can move your spouse and dependents over to an individual plan. There are no pre-existing conditions, so if they have had medical conditions in the past, they will get coverage through an individual policy. They won't rate up if they've had pre-existing conditions. The rate is based on age and where you live. It's not even based on gender anymore. So many changes out there. Again, if you have any questions, please keep emailing me. Give me a call. Just let me know. Glad to help. Thanks.